Sucralfate. What is a sucralfate and how does it work? Sucralfate is indicated for short-term treatment up to 8 weeks of active duodenal ulcer. While healing with sucralfate may occur during the first week or two, treatment should be continued for 4 to 8 weeks unless healing has been demonstrated by X-ray or endoscopic examination. Sucralfate is also indicated for maintenance therapy for duodenal ulcer patients at reduced doses after healing of acute ulcers. Sucralfate is available under the following different brand names: Sucrafil. Doses of sucralfate. Dosage forms and strength: tablet 1 gram, oral suspension 1000 mg per 10 ml. Doses consideration should be given as follows: duodenal ulcer. Adult 1 gram orally every 6 hours initially. Maintenance 1 gram orally every 12 hours. Take on empty stomach 1 hour before or 2 hours after meal. Pediatric off level 40 to 80 mg per kg per day orally divided every 6 hours. Stress ulcers off level. Prophylaxis 1 gram orally every 6 hours 4 to 8 weeks. Take on empty stomach 1 hour before or 2 hours after meals. Stomatitis pediatric off level 500 to 1000 mg orally every 6 hours 1 gram per 10 ml. Suspension every 6 hours. Swiss and spit or Swiss and swallow the suspension. Gastric ulcer pediatric off level 40 to 80 mg per kg per day orally divided every 6 hours or zero point 0.5 to 1 gram orally every 6 hours. Dosing modifications. Renal failure use with caution. Aluminum salt may accumulate. Slideshow. Super tips to boost digestive health, bloating, constipation, and more. See slideshow. What are side effects associated with using sucralfate? Side effects of sucralfates include back pain, constipation, diarrhea, dizziness, drowsiness, dry mouth, gas, headache, indigestion, itching or skin rashes, nausea, sleep problems, spinning sensation, stomach pain, upset stomach, vomiting. Other side effects of sucralfate include Bezoar's formation, gastrointestinal discomfort. Post-marketing side effects of sucralfate reported include hypersensitivity reactions, high blood sugar, hyperglycemia. What other drugs interact with sucralfate? Serious interactions of sucralfate include dolutegravir. Moderate interactions of sucralfate includes ciprofloxacin, fluroxacin, furosemide, gemifloxacin, ketoconazole, levofloxacin, moxifloxacin, norfloxacin, ofloxacin, vitamin D. Mild interaction of sucralfate include aluminum hydroxide, anagrelide, demeclocycline, doxycycline, ethylene, phos- phosphatoin, lansoprazole, limecycline, minocycline, tetracycline, phenytoin, tetracycline, warfarin. What are the warnings and precautions of sucralfate? Warnings: this medication contains sucralfate. Do not take carafate if you are allergic to sucralfate or any ingredient contained in this drug. Keep out of reach of children in case of overdose. Get medical help or contact a poison control center immediately. Contraindication: documented hypersensitivity. Effects of drug abuse: none. Short-term effects. See what are the side effects associated with using sucralfate. Long-term effects. See what are the side effects associated with using the sucralfate. Caution: not expected to alter the post-healing frequencies of recurrence or severity of duodenal ulceration. Acts locally at the ulcer. Do not take antacids within 30 minutes of sucralfate dose. Aluminum absorption is increased. Use with cautions in patients with chronic renal failure or undergoing dialysis. Potential significant drug interaction possible. Consult drug interaction database. Use tablet with caution in patients with conditions that may impair swallowing or with altered gag cough reflex. High blood pressure, hyperglycemia has been reported when drug is used in patients with diabetes. Sucralfate may alter the absorption of some drugs. Take other medication 2 hours before taking sucralfate. Pregnancy and lactation. Sucralfate may be accepted for the use during pregnancy. Either animal studies shows no risk, but human studies are not available, or animal studies showed minor risk, and human studies were done and showed no risk. Sucralfate was probably safe for use during lactation because the drug is minimally absorbed. It is unknown whether sucralfate is excreted in breast milk. Consult your doctor.